Only in America can a young black man with a high school diploma rise to high ranks in medicine. This is essentially an uplifting Black American overcoming saga. It is also about American racism. It's complicated. There are parallels in Vivien Thomas's story, familiar to come to America industrialists, and rugged pioneers planting the West story, all building this great nation during hard times like the Great Depression and the Jim Crow era. But what is different is a particular obstacle that others did not have to deal with on their American dream journey: anti Black racism. This is the story of a man who, in spite of racism, held strong to his American dream without a promise of glory along the way. Like thousands of unheralded Black men and women, he loved his homeland. He believed in the opportunities despite the roadblocks, and he practiced traditional American values like patriotism, faith, and family. This is his story. Meet Vivien Theodore Thomas, a good looking young man born in 1910 in Louisiana. He had a role model father named Willard Thomas and a loving mother, Mary Alice Eaton Thomas. His father was a carpenter who took pleasure in teaching his sons the trade, skills that opened a door for Vivien to land a carpentry job at Fisk University. He graduated from Pearl High School in 1929 and hoped to attend college, but this was the beginning of the Great Depression, and there was no opportunity to earn money for college. A childhood friend working at the Vanderbilt University lab enticed Thomas to seek a job there. He still wanted to go to college and perhaps he could earn the money there. Meet Dr. Alfred Blaylock. Alfred Blaylock was born in 1899 in Georgia. He graduated from the University of Georgia and Johns Hopkins Medical School. What we know is that he was not adverse to hiring Thomas, a black man, despite his lack of medical or laboratory training. Dr. Blaylock had a reputation for being hard to work with. Thomas wrote in his autobiography that during his job interview, he found Blaylock to be pleasant, relaxed, and informal. This made him feel comfortable in anticipation of getting the job and working with the man. Blaylock was known to move quickly and expected his technicians to be just as efficient. Thomas got the job, but he soon found that at times Blaylock would lose his temper and use profanity. This bothered Thomas, and over time, tensions built up and persisted throughout their 34-year partnership. In the lab, Thomas hit the ground running. After landing the job as surgical research assistant, his training began. On his first day of work, Thomas assisted Blaylock with a surgical experiment on a dog. At the end of Thomas's first day, Blaylock said they would do another experiment the next morning. He said, quote, "Come in and put the animal to sleep and get it set up," end quote. Blaylock performed experiments daily, and an excited young Thomas observed carefully and memorized every procedure. Soon he could recreate the procedures on his own when Blaylock had other responsibilities to attend to. Within a few weeks, Thomas was starting surgeries on his own. The kicker was that Thomas was classified and paid as a janitor. Despite the fact that by the mid 1930s he was doing the work of a postdoctoral researcher in the lab, but his pay remained that of a janitor. In the summer of 1933, Thomas met and married Clara Beatrice Flanders, and they had two daughters. Now he had a family to take care of. He continued working with Blaylock at the lab. This was the Depression, and Thomas struggled financially, spending his earnings just to survive. His janitor salary could not provide comforts or allow him to save for college. 9 months after starting the lab job, Nashville banks failed. His savings wiped out. Sadly, he had to abandon his plans for college and medical school. Survival was Thomas's biggest challenge, and despite exemplary services to Blaylock's work, requests for pay increases were declined. Thomas considered returning to his old job as a carpenter, but being essential to Blaylock's work and loving what he did kept him tied to Blaylock. Blaylock's Southern mentality dilemma was that he was dependent on the outstanding talents and expertise of a black man to succeed in reaching his goals, and he was unwilling or incapable of respecting the man enough to treat him fairly. Blaylock discriminated against Thomas at every turn, regardless of his indispensable value. Thomas was never publicly acknowledged for his contributions to the work in official articles, nor was he pictured with the team of white doctors responsible for groundbreaking medical procedures. Blaylock needed Thomas, and the two worked together at Vanderbilt for 11 years. So while treating Thomas like a field hand, Blaylock had no choice but to uplift his work to his superiors at Vanderbilt and Johns Hopkins. In 1941, Blaylock accepted Johns Hopkins Hospital's positions as chief of surgery, professor, and director of the Department of Surgery at the medical school. He immediately requested that his assistant, Vivien Thomas, come with him. Blaylock insisted that Thomas accompany him in the operating room, despite no medical credentials. One source wrote that, quote, when the first surgery was performed in 1944, Blaylock had the scalpel, but Thomas stood behind him, guiding every move. Thomas wasn't just an assistant, he was the mind behind the surgical technique that would save thousands of infants suffering from blue baby syndrome. End quote. Also in 1941, Thomas moved his family to Baltimore to continue working with Blaylock. When his family arrived, they found a severe housing shortage and a level of racism worse than they had endured in Nashville. Johns Hopkins, like the rest of Baltimore, was rigidly segregated, and the only black employees at the institution were janitors. When Thomas walked the halls in his white lab coat, many heads turned, so he began wearing street clothes when he walked from the laboratory to Blaylock's office because he received so much attention. There were limits to Thomas's tolerance, especially when it came to issues of pay, academic acknowledgement, and social interactions between colleagues outside of work. Tensions between Blaylock and Thomas continued to build. The rift broadened. It was an outrage when they suppressed clear documentation of Thomas's contributions to groundbreaking outcomes that showered Blaylock and white doctors with multiple awards. As noted, Thomas was central to the world-famous surgical technique for blue baby syndrome. His involvement in research saved thousands of soldiers' lives during World War II. In hundreds of experiments, the pair disproved traditional theories, and provided procedures for new ones. Blaylock's recognition in the medical community blossomed. They did experimental work in vascular and cardiac surgery that lifted the medical taboo against operating on the heart. It was this work that laid foundations for revolutionary, life saving surgery performed at Johns Hopkins a decade later. After Blaylock's death from cancer in 1964 at the age of 65, Thomas stayed at Johns Hopkins for 15 additional years. In his role as director of surgical research laboratories, he won the respect of students and academics. He mentored a number of Black American lab assistants as well as Hopkins' first Black cardiac resident, Levi Watkins Jr. Thomas assisted his groundbreaking work in the use of the automatic implantable defibrillator. In 1968, surgeons trained by Thomas, who had then become chiefs of surgical departments throughout America, commissioned the painting of his portrait by Bob Gee. In 1971, Thomas was recognized for all his work, quote, behind the scenes, quote, with the ceremony and the presentation of his portrait designated to hang beside Dr. Albert Blaylock's in the Alfred Blaylock Clinical Sciences Building at Johns Hopkins Hospital. At the ceremony, Thomas spoke humbly to the full capacity auditorium. He stated that he lived in humble satisfaction that he was able to help solve some of the world's numerous health problems. He was overjoyed that he was finally getting recognition for his significant role in the research leading to developmental skills that many surgeons had begun to practice. In 1976, Johns Hopkins University presented Thomas with an honorary doctorate. Due to certain restrictions, he received an honorary Doctor of Laws rather than a medical doctorate. But it did allow the staff and students of Johns Hopkins Hospital and Medical School to call him Doctor. After working there for 37 years, Thomas was also finally appointed to the faculty of the School of Medicine as instructor of surgery. Although, due to his lack of an official medical degree, he was never allowed to operate on living patients. Thomas served in that capacity for 3 years and retired in 1979. Vanderbilt University Medical Center created the Vivien T. Thomas Award for excellence in clinical research. Dr. Vivien Thomas. We honor the man. We also honor the culture of a people that created such a man.